Fall risk screen needs to be completed at least Q shift. The frequency of fall risk interventions is determined by the patient's risk level. If a patient is high risk, we need to document the fall prevention intervention Q2 hours. For moderate or low risk, BID. Again, remember the blue reference text links. These will often have more detailed information about the fall risk fields. The fall intervention task has now moved from the Schedule tab to the PRN Continuous tab. Because of this, it will not put the documentation time into nice 2-hour increments. You will need to remember to document your fall intervention Q2 hours for high fall risk patients. Some other options are, number one, you can still use the continuous task and just insert your own time slots. Number two, you can just change your iView time slots to Q2 hour intervals and document your fall interventions. Now let's talk about the CSSRS suicide risk patients. If a patient is at high or moderate risk for suicide, a patient safety attendant or PSA needs to document 15-minute checks. If the patient is at high risk, this will need to be done at the bedside. If the patient is at moderate risk, the PSA can be in line of sight. Both high and moderate risk will need a paper care plan done. A patient safety plan needs to be completed upon discharge. A lifetime assessment needs to be completed by the social worker. The turquoise wristband is for high-risk patients, and the band stays on until a lifetime assessment is completed and the patient screens either as a low or no risk. The provider will need to document on the 6 risk factors for suicide when deciding to discontinue the PSA. PSA documentation needs to start from the time the patient is deemed a high risk until we get an order from the provider to discontinue the PSA. Document under Communication Physician the time the physician gives the OK to remove or discontinue the PSA. The care plan is a paper form. Make sure all the fields on the care plan are completed, including the initials. Also make sure your signature has a date and time. On the flow sheet, make sure all the documentation at the top is completed on each page of the form. It needs to be done every 6 hours. Document on the flow sheet when the PSA is discontinued. Finally, remember to complete the patient safety plan upon discharge. The sitter monitoring form, on the other hand, is for non-suicide risk patients. Remember to fill out all the fields on each page of the sitter monitoring form and make sure that the start time matches the time on the flow sheet. Now let's talk about social history. Default filters on our social history page shows all active documentation. So any documentation on the social history page will trigger consults to our dietitians, case managers, social work, and chaplains. It is important to keep the social history up to date and remove any old documentation. Now let's talk about some basic steps in documenting social history. Number 1, modify previous documentation by double-clicking on the assessment. Number 2, if you are unable to modify, remove that assessment and create a new one. Number 3, remove any other older documentation by doing a right-click and selecting Remove. If nothing changed and everything is the same, go ahead and click Mark as Reviewed. You will still be able to see these discontinued assessments by changing your drop-down filter to All. Now let's talk about medications on discharge. Remember to give education on any new medications. It is good to include the handout for that new medication as part of the discharge instructions.